Welcome to World Pharmacy Week. My name is Marlies Means and I'm the Marketing Manager at Lady Pohamba Private Hospital. Our guest today is Ms. Maya Ankama, a pharmacy at LPPH. Welcome.
Thank you for having me.
Today's topic is HIV and AIDS. What is HIV and how is it transmitted?
Well, Marlies, HIV, which is the human immunodeficiency virus, it basically attacks your immune system and then it weakens the body's ability to fight off infection. HIV can be transmitted from an infected person to an uninfected person through bodily fluids. So this can happen during child labor, from mother to child, and also during breastfeeding, through having sexual intercourse with someone who is infected as well, unprotected sexual intercourse, that is. Okay, so those are just some of the few that we have.
Okay. And what are some of the common symptoms of tuberculosis, TB, and how is it spread?
Okay, well, firstly, tuberculosis, it is an infection, bacterial infection that usually affects the lungs, all right? But it can also affect other body parts. Some of the symptoms of the pulmonary TB, which is the one that affects the lungs, include a cough for longer than 2 weeks. It can also include fever, night sweats, and weight loss. TB is usually transmitted through air droplets when an infected person maybe coughs or even sings, you know. So it's very important to ventilate rooms in that regard.
Why is it important to take HIV and TB medication as prescribed?
Well, it is very crucial to take this medication as prescribed for TB and HIV in order to aid controlling these two giants. With HIV, when you take the medication accordingly, what would happen is the viral load will reduce and then your immune system goes up and then it basically decreases your chances of getting AIDS. With TB, it just makes sure that we eradicate the bacteria that is causing the TB so that you're cured, because TB is curable. So, yes.
Very important. What happens if somebody misses a dose or stops taking HIV or TB medication?
Okay, so if you do miss a dose for both, okay, let's start with HIV. If you miss a dose for HIV, what will happen is your viral load will do the opposite. It will go up and your immune system basically goes down and you will progress into AIDS. And with that, obviously, as we know, you can die, unfortunately. And with TB, what would happen is usually the virus becomes resistant to the medication, which is, you then get what we call MDR-TB, which is multi-drug resistant TB, which is very expensive to treat and it's very complex. So we have to take our medications as prescribed.
So adhere to your medication.
Absolutely.
Okay. And what should somebody do if they have experienced side effects with HIV or TB medication?
Okay, so once a patient experiences side effects, it is very important that you please do not stop taking your medication. We encourage that you seek help from your healthcare professional as soon as possible. Okay, then it will then determine the next course of action, whether it is to change or decrease your dose, or if you have to bear it out, because some side effects are self-limiting. So yeah, within a couple of weeks, you should be fine. But it is very important that you are very honest with your healthcare provider so that you don't have any complications. So once you see something, please seek out help.
Very important. Thank you very much for your time.
Thank you for having me.
The podcast is proudly sponsored by Lady Pohamba Private Hospital. And if you've got any questions, please visit your healthcare service provider immediately.